Good afternoon, everyone. I'd like to acknowledge the local custodians of the land in which we meet today and honour elders past, present and emerging. I'm Melissa Wilkinson from the education team at the Hunter New England Central Coast Primary Health Network. Welcome today to the 12-week WAL Mastermind session. It's lovely to have Casey Wisemetal, PCIO from the PHN, and Executive Manager John Bailey online with us today. Hi and welcome. Just a little bit of housekeeping. There will be a survey at the end. We value your input, so I encourage you strongly to complete that. Also, could you please remain on mute? And if you have any questions, could you please place those into the question box? I'd also like to mention that we have an upcoming event on the 27th of April. It's a immunisation update with the primary care quality improvement community of practice event. There'll be a brief update there from Patrick Cashman on the flu vaccine. John Bailey will be talking about the COVID vaccine, and Casey and Ross, our lovely PCIOs, will be discussing the quality improvement activities around those. So that's also on our education calendar and the education library on our website. So feel free to hop on there and register for that event. I'll now hand over to Casey to commence. Over to you, Casey.
Thanks, Mel, and welcome everybody. So thanks for joining John and I today, and we're going to take you through a process for planning for what happens once you hit the 12-week mark in the rollout for the COVID-19 vaccine. So I'm going to be talking about the 12-week wall, what it means, what's involved, and how you can get over this wall, and then at the end, we'll allow time for questions. Also, don't forget that World Immunisation Week is running this year from the 24th to the 30th of this month. And this year's theme is Vaccines Bring Us Closer Together. So vaccines will once again put us on a path to a world where we can be together again, hopefully soon. So your onboarding letter outlined the number of doses that you'll be receiving each week for the first 12 weeks of the program. But have you started thinking about what's going to happen when you hit the wall at the 12-week mark? How are you going to move forward? Do you think you might have capacity to increase the amount of vaccines that you're receiving? We are hearing from a few of you that you do want to increase the amount. So it's time to think about the things that you need to consider to help increase your capacity. So you've probably already got plenty of thoughts going around inside your head, such as where do we want to go? And I mean with the rollout of the vaccines and not your next holiday. As with most projects that you're undertaking in general practice, it's really important that you plan and review your processes. So this is so that you can make changes that will hopefully provide you with an outcome that's going to be successful. We all know about those PDSAs, don't we? So what's been working well for you during these first few weeks of the rollout? What lessons have you learnt so far? Do you think that there's anything that you could or should be doing better? Would employing additional staff help with your processes? As you've registered as a COVID-19 vaccination service provider, you have a really important role to play in ensuring a safe rollout of the vaccine to our community. Thank you for all that you've done so far, and I realise that at times it's been extremely trying with misinformation being posted on social media and discussed via our media outlets. And there's also been a few changes made as we go along, and they're still happening now. So in the first 12 weeks, the Department of Health stipulated that you are required to deliver your weekly allocation consistently. Your allocation may increase when more doses become available and allocations have been reviewed. So by getting your practice flow right, which you do by managing your clinics, your appointment book and your vaccine orders, will ensure that you're ready for what's to come when you reach the weeks that follow. So when we're talking about capacity, I mean things such as staffing, physical space and bookings. What about unexpected events? And we've certainly experienced a lot of those in the last 12 months. Drought, bushfires, floods, and then a little pandemic along the way. So what about vaccine management? All of these factors combine to build up a wall, but we need to figure out a way to deal with them and get around it in order to move forward. And you've also got all of the other business as usual tasks that you need to contend with. So as you can see on this wall, we've provided you with multiple examples, but please, at your next team meeting, feel free to consider what's in your bricks that are creating your wall, that are potentially creating a barrier that are preventing you from increasing the volume of vaccines that you can administer. We all know that you will get faster and better as time goes on and you become more accustomed to the process, which will become more and more streamlined as we progress. If you don't do anything, the wall's going to stay there and you'll keep banging your head against it and become more and more frustrated. So it's really important that you put pen to paper and create a visual plan to help you consider all of the variables that may occur. So when planning for the vaccine rollout, have you considered public holidays, school holidays? So some people might say that a date is fine, but when they realise it's school holidays, they're actually going to be away. And what about when people receive their first dose in the first 2 weeks of October? Go to get booked in for their second dose and you find that it's the week of Christmas and no one will be working within your practice. That'd be a fun one, wouldn't it? So you've been provided with some ideas involving what might be contained in your wall, the factors that you need to consider, the elements that are outside of your control, and everything that you had planned and organised for that went totally out the window when the guidelines changed. So we want to help you build some steps to get you over this wall once those 12 weeks have passed. So step 1, refine your workflows and processes for efficiency. It's important to continue to plan your workflow and adjust to any changes that may occur with the vaccine whilst continuing to maintain your regular business. You still have to deal with acute appointments, chronic disease management, and cancer screening. In order to increase capacity of the vaccine rollout, is the physical space of your practice going to be adequate? How can you best manage patient flow? It's important that there are clearly defined roles and plans in place. Are your staff working within their scope of practice? For example, are your authorised nurse immunisers running your COVID vaccine clinics? And this will help free up your registered nurses and enrolled nurses to run your flu clinics alongside the GPs. So what's going to work for your practice and for your staff? You really need to think about it. Appointment book. Are you managing your appointment book to run COVID vaccine clinics at specific times? Are you keeping your COVID-19 vaccine appointments completely separate from your flu vaccine clinics and your general day-to-day business? Is that what's working for you? So where will the next groups of the COVID vaccines fit in? Do you have protected time to manage your vaccine ordering and reporting? The department is aware that there's been some delay with the arrival of those items that include the consumables, that includes needles and syringes, and they're hoping to fill those back orders soon. So clinical advice continues to change. The hyped up and often misleading information that's provided by our media can cause unnecessary panic and stress. As the guidelines change, it's important that you review and adapt your strategies. As health professionals, it's really important to know who your reliable resources for information are. So please always refer to the Department of Health, ATAGI, NCIS, TGA and Health Pathways as your most reliable sources of information. Once new vaccination information is released by the Department of Health, TGA and ATAGI, Health Pathways are updated by our local clinical editing team, and this sometimes happens on a daily basis. So managing staffing levels is really critical. Don't decide the day before your nurse goes on maternity leave it's the time to recruit for a new nurse. You need to factor in the different types of staffing leave, who's on annual leave and when. And the last step, it's important that you're able to maintain business as usual. We all know how important it is to continue to immunise, not just our children, but adults too, in accordance with the National Immunisation Program. As you probably already know, it's now mandatory to report COVID-19 and flu vaccines to the Australian Immunisation Register. And this means any type of influenza vaccine must be submitted to the ES, so both your private and government funded vaccines. And mandatory reporting will be extended to include all vaccines from the 1st of July this year. So I'd now like to let you know where you can find some hints and tips for planning and delivering the COVID vaccine clinics that will help you manage your practice flow, which can be a real challenge. Like I said, I suggest that you read Health Pathways and look at the pages on preparing for COVID-19 vaccination and COVID-19 vaccination procedures. Also, take a look at our website and you'll find resources that some of our PCIO team have developed, particularly the COVID-19 Vaccine Clinic Toolkit. So the toolkit provides you with a team approach for general practice in preparing the rollout for the vaccine. And we've provided you with various examples of workflows that you may find to be of great use. And we've certainly received some great feedback on this resource. So managing your clinics and appointment book. How are you going to incorporate business as usual along with your vaccine clinic? Plan that the vaccine doses you have available match the appointments you have reserved for your clinics, and don't let any of those precious doses go to waste. And one very important thing that you can do when patients first present for their first dose is to book them in for their second dose immediately. It's best that you have control of the booking for the second dose. And by booking them in advance, you'll reduce the need for recalls, reduce the risk of accidental double bookings, and meet your PIP requirements for the COVID vaccine. You don't need to have the second dose bookings available online. Just remember that. If you have a patient requiring their second dose with you when they've received their first dose elsewhere, it's important that you're able to have a phone conversation with them to ensure the appropriate interval between the vaccines has occurred and that you are aware of any possible issues so you can plan ahead accordingly. So managing your vaccine order. This includes the stock acceptance form and management forms. Please refer to the onboarding kit that you receive from the department and the weekly bulletin updates that you receive by email. You get them from the Department of Health for current advice. So the weekly bulletins are sent to the registered email address. So if you are the person receiving these, you should perhaps consider forwarding them on to other members of your team. Think about who is allocated and when they will have allocated time to complete these daily and weekly tasks that you've identified. And we know there's no healthcare without self-care. Please, you need to look after yourself and your colleagues. Just a reminder that in recognition of the hard work that you've undertaken over the last 12 months, the PHN is offering general practice staff the opportunity to receive a one-off small grant to support activities or events that promote wellness. So if your practice hasn't applied already, I suggest you do so. And feel free to contact your PCIO if you require any further information. And that's it from me. Please remember your key contacts for everything directly related to the COVID-19 vaccines. The top email is your link to the PHN COVID response team, and the VOC is your Department of Health contact for queries around ordering, deliveries, and reporting to the portal. Not portable. John, did you have anything to add?
Thanks, Casey. Great presentation. That was really good. Thank you for that. Just wanted to talk about a couple of questions we've had in the question box and remind people that they can ask those questions online, and we'll do our very best to answer them. So we've had a question around the number of vaccines that practices are receiving. This practice is saying that more than 50% of their patients over the age of 70, and due to that, they think they need a minimum of 200 a week, but they're only getting 50. So let me just cover off on that. The issue at the moment is the supply of vaccine, not your capability or your capacity to deliver it. In Australia, we are producing the vaccine onshore and importing from Europe the remaining vaccine quantities. At the moment, the vaccine production is ramping up, and it will reach its peak in about 6 to 8 weeks' time, at which time we expect the supply to increase. We are well aware that practices have had significantly less vaccine than they would be able to deliver, and we're constantly taking that up with the department. But again, the issue is the supply. No one's getting any more or any less than what they originally advised they would get. We are aware and we know that practices said they could deliver more than what's been allocated, and that's a national issue. It's one that we can't change until the supply of vaccine increases, and that will increase as we get additional supply in Australia, and once the European Union release supply to us as well. And as most of you would know, there are currently limits on what can be exported out of the EU. The other thing I just wanted to talk about a little bit is consumables. So we know that many of you have been running right down to the wire in terms of consumables, and the consumables are not often delivered at the same time as the vaccine. Sometimes they're delivered before and sometimes they're delivered after. So what we've managed to do is we've managed to get a small supply of consumables, that is syringes, needles and sharps containers, and we are able to fill where there's an urgent need and you haven't received a supply from the National Vaccine Operations Centre. To be able to access the locally held supply for urgent stopgap measures, what we'd ask you to do is register for Capacity Tracker and put a request through Capacity Tracker. Casey, thank you. I'm just going to ask you to put that slide back up. So again, if you register for Capacity Tracker at au.capacitytracker.com, we'll be able to assist you when you feel that you're running short or that you think your delivery is not going to match the date at which you want to do a clinic. Casey, we've got a question from Kath Teagle. What's AEFI?
Oh, sorry, adverse events following immunisation.
Thank you. And I think that's excellent. Yeah. With any other questions or anything? Casey, I'm aware that a number of practices are really smashing it out of the park in terms of really clever ways they're doing things. And have you seen anything that you think has been sort of out of the box and you think, oh, I should tell people about that? No? Let me tell you about one I saw then. So I had my first dose of COVID-19 AstraZeneca vaccine about 2 weeks ago now. My practice sent me a text message telling me that I was eligible due to my health conditions, not my age, but my health conditions. And I was able to go online, book an appointment, and fill in the consent form online. So answer the eligibility question, fill in the consent form online. So I could actually digitally sign it online. That then went through to the practice system, and I then was able to find an appointment with the authorised nurse immuniser, which were then subsequently confirmed by text message. Didn't make any phone calls, did all of that online, all with text messaging, including the consent, absolutely seamless. When I arrived at the practice, I was greeted by a staff member who took my temperature and asked me all of the COVID entry questions. And then I went up, had my vaccine, sat in the practice for the mandatory 15 minutes, and then left. And after that, probably within about half an hour, had a text message confirming my second appointment date and time. Very, very smooth. I think that what we need to do is have a look around at some of the clever things that are being done in other practices and, you know, learn from our colleagues. So I'd encourage you to attend the quality improvement community of practice meetings or some of the other meetings where you can share your ideas and help people who might be struggling. So Jane has said they're struggling to fill their appointments. Any suggestions? Jane, a couple of things I'd suggest to you. Firstly is that you run PenCat over your data and do an extract and identify patients who meet the eligibility criteria. In other words, they're over the age of 70. They have an underlying chronic health condition as per the guidelines, or they're an Aboriginal Torres Strait Islander person above the age of 50. And then you do a reminder and recall. Invite them to come rather than waiting for them to come. That's the way a lot of practices are doing it. You will then, I believe, have a wait list that you'll be able to work through. So probably being a bit proactive and using a reminder and recall system in a way that, you know, we use for other things. The other opportunity is to open up your booking system on the Health Direct eligibility and a location finder. So if you're struggling to fill your appointments, I'm sure if you could do that online, you'll be able to fill them pretty quickly. So from our team, any questions that you might want me, so we're getting some questions around the 50 to 69-year-old. So let me just say that at the moment, as it stands, AstraZeneca is recommended for people over the age of 50, but the current 1B cohort is for people over the age of 70. National Cabinet are meeting tomorrow, and it is possible, I'll say possible, that they may broaden the current eligibility down to 50. So we'll just have to wait and see what happens in the 50 to 69-year-old age group after tomorrow's National Cabinet meeting.
John, I've got a couple that have come through as well. When can I contact the VOC?
Look, you can contact the VOC during, I believe it's normal business hours, but I'll rely on one of my team to let me know if that's wrong. So the times to contact the VOC are where you have supply issues, either vaccine or consumable. Just noting my comments earlier about the small supply of urgent consumables that we've got. You can register with the VOC if you want to have your vaccine quantity increased, but note that the supply constraints are the issue at the moment. If you've had issues with the delivery, so some practices have said that the logistics companies have tried to deliver after hours or weekends, those sorts of issues can be taken up with the Vaccine Operations Centre. The Vaccine Operations Centre have twice daily meetings with the logistics company to iron out some of these issues. And unfortunately, we can't advocate on behalf of individual practices. We can take up systems issues, but if you've got an individual practice issue, then contact the VOC. The VOC's open from 7 AM to 10 PM. Thanks, Kim.
Great. And the last question I've got here is who's responsible for reporting on adverse events, reactions?
Casey?
So generally, well, it is the person who sees the patient reporting with the adverse event. If the person is fine after they receive the vaccine and then perhaps present to ED, we know that hospitals aren't that great with reporting. So if I was the GP and the patient came back and told you at a consult, then I would be seeking all the details and lodge it. And New South Wales Health and TGA, they can deduplicate the reports on the off chance that the hospital does lodge one. So yep, generally it's the person who's speaking to the patient.
Thanks, Casey.
And we've got another question there from Kath Teagle. Kath says that she contacted the VOC through their allocation and they told me to ask the PHM. Kath, unfortunately that bypassing is occurring, and look, we have no visibility over the allocation or the distribution. What we are advocating for are systems issues. The volume and frequency of allocations are determined by the department. They then advise the Vaccine Operations Centre and the logistics distribution. So I apologise that you've gotten a runaround, but I can absolutely assure you we don't have any control over the vaccine allocation. So we've got a couple more questions. Kim's made a good comment. When you do contact the VOC, they will give you a ticket number, which is a unique number for you to be able to use when you have to contact the VOC again. Please make sure you write it down and keep a record of it. Otherwise you have to go through, it's almost like ringing your bank. You have to go through multiple hoops. Write down the case number or ticket number, and that gives you quicker follow-up. Do you know the process to ask the VOC for more? Yeah, Kath, what we're suggesting to practices is do two things. Contact the VOC and tell them that you are willing to take more vaccine if any becomes available. And then if you can also just drop us an email at vaccine@thephn.com.au. While we're not able to allocate, we can certainly then say to the department in our twice weekly meetings that there is demand for additional vaccine, and this is what it looks like in terms of numbers. So drop us a quick email just saying, hey, if there's any opportunity to get an additional vaccine, we could use an extra whatever it is. We'll make a record of that and then take that up with the department. Have there been any updates on when logistics companies will come back to collect the boxes? Joanne, I haven't heard that in recent times, but I will get Kim from my team to follow up, and we might just put something out in the next newsletter. I'll try and get a definitive process. The process was supposed to be that when they drop one vaccine off, they collect the packaging from the previous drop-off. Now, I'm aware that that's not always occurring, and unfortunately, it seems to be a bit of a hit and miss approach by the local delivery drivers, but we'll certainly see if we can get some consistency in that and take that up with the VOC. That's something we can advocate for. If a patient fills out the consent form online, HotDoc, do they need to fill it out again, consent form, when they come in? Some patients completed online and others don't. Provided you have a record of the consent form in your system or have visibility over it, whether that's online or in person, and it's a valid consent, that is all that you require. It doesn't matter what format it takes, so long as you have A, a copy of it, or have access to a copy of it, and B, it is a valid consent. In other words, all of the appropriate questions have been asked and the proper declarations have been made. So Kate says that she emailed the VOC and they collected one box today, but they still have one box waiting to be collected. Driver said he only had paperwork to collect one. Yeah. Unfortunately, the challenges of working with multiple delivery drivers is proving to be one of the most difficult things in this whole process. I think the logistics companies are doing their best, but local drivers are doing what they need to, when they need to, with a piece of paper in hand. Nothing more, nothing less. And that is a regretful situation, but it's unfortunately what we have to deal with. Mel, I'm going to have to step off, and I'll happy to answer any questions after. I've got another meeting.
Right.
With the,
Thank you so much, John, for being with us, and thank you, Casey. We've run right on time this afternoon. If there's any further questions, I'll have them emailed through to you both to respond to as well. So thank you, everyone, for attending this afternoon. Thank you, Casey. Thank you, John. Today was recorded, and you'll be able to view it on our Education Library on our website. And please remember, the survey will be popping up on your screen very shortly as soon as I close the webinar, and we ask that you please complete that because your input is really valuable to us. Thank you, everyone, and have a lovely afternoon. See you, Casey. Bye.